Hello everyone, my name is Maharlika Diarse. I'm going to be doing subcutaneous injection administration. Before I start, I am going to let you guys know I have my Nightingale scrub top, Nightingale scrub bottom, Nightingale badge. My hair is tied back. There's nothing on my nails, no acrylic nails, no hanging jewelry. Miss Smith, her belly, heparin, 10,000 units, 10 ml that is available. Alcohol pads, gloves, gauze, and my 1 ml equals to 100 units syringe, and my dosage calculation. There's nothing on the back. Alrighty, before I start, I'm going to check the EHR. The EHR is the EHR and the MAR is 1,000 units of heparin. And 1,000 units of heparin, and my dosage calculation is 10 ml over 10,000 units equals 1,000 units over 1 equals 1 ml. So that is 100 units. That's 1 ml. I have a 1 ml syringe. Alrighty. Before I start, I'm going to verify the 6 rights: right patient, right drug, right dose, right time, right route, right documentation. Alrighty, now that I have done the dosage calculation on the side, I am going to gather my supplies, walk to the patient's room, knock on the door, provide the privacy curtain, place all my supplies on a clean flat surface, check the room if there is any family members. There's no family members. We don't want to violate any HIPAA violations. Alright, so now I'm going to wash my hands. Miss Smith, my name is Maharlika. I'm going to be your nurse today. Can you please verify your name and date of birth? I'm going to check this time to do a verification. Name and date of birth. Check the EHR. Alright, perfect. Everything correlates. Alright, Miss Smith, I am here today to do a subcutaneous injection administration. And your provider ordered you heparin. Heparin is to prevent any blood clots in your system. Some common side effects are fever or hypersensitivity, and some adverse side effects are shortness of breath, bleeding, and also hives. If you have any of these adverse side effects, please let us know immediately. Do you have any allergies, Miss Smith? Any medication allergies, food allergies, seasonal allergies? No? Alright, perfect. Do you have any questions for me? No. Alright, so I'm going to wash my hands. Now I'm going to prepare the medication. So I'm going to put on my gloves. Now I'm going to check the medication vial, make sure that it is for Miss Smith and it is heparin, and I'm going to check the MAR, EHR, second verification. Alright, perfect. So now that we have verified that, now I'm going to clean the medication vial with alcohol swab, inner to out. Alrighty, making sure, put that in the trash bin. While we are letting that air dry, we are going to open the syringe. Package. So now we are going to draw 1 ml of air while the cap is still on. Alrighty. 1 ml. Perfect. Alright, so now we are going to, now that the medication vial is dry, we are going to uncap this, uncap the syringe. And I did not hold the plunger, and it is still at 1 ml. Uncap the syringe, place this cap onto there. So now we are going to hold it like a dart straight down into the medication vial. Perfect. So now we are going to put the 1 ml air into the medication vial, like so. So now we are going to invert the medication vial. Make sure that the needle does not bend. So now we are going to draw 1 ml of the heparin. Making sure that there are no air bubbles. Perfect, no air bubbles. There we go. So now that we have no air bubbles, now we are going to do the 1 scoop method. 1 scoop method. Alrighty, and now we are going to cap it. So this is 1 ml. Alright, perfect. So now that we have the 1 ml, put that away. Alright, Miss Smith, I'm going to inspect your belly area. I'm going to inspect it, making sure that there is no masses, no masses, no discoloration, no tenderness, no bruises. Do you have any tenderness here, Miss Smith? No? Alright, perfect. So everything looks great. Everything's inspected. So now I am going to clean the area, the injection site. I'm going to just clean, so now I'm going to clean inner to outer in a circular motion 2 inches away. All right, perfect. So now I'm going to throw that away. So while that is air drying, when I am going to inject the subcutaneous injection, the heparin, I'm going to grasp the belly. And then I am going to hold the syringe at a 90-degree angle, 45 to 90-degree angle. I will go 90-degree angle while I'm grasping the skin, and then I'm going to put as palm down like this, and while it is in, I'm going to, with my non-dominant hand, I'm going to stabilize the syringe barrel with my non-dominant hand with my thumb and my finger. Now I'm going to just inject the heparin into the belly. All right, so now that it is air dry, I am going to make sure that I grasp it like this, like so. All right, so now I didn't touch the injection site, so now I am going to take out the cap. So now I'm going to hold it like so, like a dart at a 90-degree angle. This is Miss Smith and this is her belly. So now I'm going to grasp the belly, making sure that I am not holding the injection site since we cleaned it. So now I am going to go at a 90-degree angle. 1, 2, 3, Miss Smith. All right. So now I am going to hold with my non-dominant hand the syringe barrel. Now I'm going to inject the heparin slowly into her belly. All right, let's just wait there for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, so now we can withdraw the needle, put this into the syringe sharps container. Now we are going to place a gauze over the injection site. All right, perfect. Ms. Smith, are you okay? All right, do you have any questions? No. All right, so all right, perfect. It's not bleeding, so we can throw this away. All right, Ms. Smith, here is your call bell. If you need anything, just please let us know. So now I'm going to take off my gloves, wash my hands, document my findings. Thank you so much.